Today we will discuss what is episiotomy. Okay, so episiotomy, it is derived from the Greek word epsion, means vulval area, and tomy means cut. It is the commonest operation in the obstetrics. Okay, so Ambrose Paré was the first person who has given an episiotomy and sutured the perineum wound. Okay, Ambrose Paré is the first inventor of episiotomy. Definition: it is a surgical planned incision on the perineum and the posterior vaginal wall during the second stage of labor, which is called as episiotomy. Okay, so indications are like malpresentation, malposition, then operative vaginal delivery, narrow suprapubic arc, then a rigid perineum, then in case of trial labor, in case of primi gravida. Then contraindications are like if there is extensive varicosity, bleeding tendency, vulval warts idre madak hogbaaರದು, that is contraindications. There are some types of episiotomy. There are 4 types: mediolateral, median, lateral and J-shaped episiotomy. Okay, next first one we will discuss regarding the mediolateral episiotomy. This is incision is made downward, okay, then outward from the midpoint of the foreshoot. Either right also you can do or left also can be done. This is the safest one. Then median episiotomy is the middle line. It is the incision starts from the center of the foreshoot and extend posteriorly along the midline for about 2.5 centimeter. Next is lateral incision or lateral episiotomy, which starts from about 1 centimeter away from the center of the foreshoot and extends laterally. Okay, J-shaped is when you see a 7 o'clock in the clock, that time incision is called as J-shaped episiotomy. It is also beginning in the center of the foreshoot only, but it extends laterally, that is J-shaped episiotomy. Commonest one is mediolateral episiotomy because there is no need of no complications, so that is best. Some procedures like preliminaries, perineum should be swabbed thoroughly, then incision should be infiltrated with lignocaine solution, that is anesthesia should be given prior to cut of the perineal wall. Okay, then after the infiltration of the anesthesia, the next step is you have to place 2 fingers in the inside the vaginal wall, then incision made with the help of blunt pointed sharp scissor. Then it should be done when there is a crowning of the head and uterine contraction begins. So this is the mediolateral episiotomy. Okay, so what it is showing is a mediolateral episiotomy and midline is near to center of the foreshoot. Then what all are the structures are cut during the episiotomy? Posterior vaginal wall, then bulbosponges or lavatory any, then fascia, muscles. Okay, those all are the muscles which is going to cut during the episiotomy. Okay, then is here what you have to remember is there is a complication. Some complications will be there when you go for a median. Okay, then after the repair should be done once the baby and placenta is expelled. Okay, all those things. Then oozing will be there, that has to be controlled with the vaginal pads. So this is how you are doing suturing, that is vaginal mucosa first, then muscle layer should be sutured, then skin should be sutured. So these sutures will be absorbed by its own, no need of removing the sutures. Okay, it will take nearly 1 week to 2 weeks, nearly 2 weeks it will take. Then what all are the aftercare? That is dressing should be done with antiseptic solution, then pain management should be done, then patient should be allowed to walk after 24 hours. Then the catgut no need to remove. Okay, then complications are some of the complications like extension of the incision or infection, wound dehiscence, chance of perineal laceration will be there. Okay, so that will be there. Next, I will show you one procedure how to do an episiotomy. Okay, you can go through with this is the episiotomy. Okay, so what all are the structures will be cut? So see, when the baby is in the uterine cavity, so when there is a uterine contraction, so okay, when there is a stronger uterine contraction, the baby there is a strong contraction which initiating from the fetal axis, so there will be a descent of the head takes place. See, this is the normal labor process. This is the vaginal birth. Okay, see, there is a molding and crowning of the head takes place. Now you can see the baby's head is at the vulval area. So what all are the reason of giving episiotomy? When you can give, that is, if the baby is large or breech position, then if the baby labor is going too quickly, okay, then extraction instruments are needed. That means if you need a forceps or inventos, so for that also you can give a episiotomy. Other than that, if the labor is going too slowly, okay, slow ಆಗ್ತಾ ಇತ್ತು labor, then mother and baby is in distress ಇತ್ತು ಅಂತಂದರೆ, then also you can give. See, before giving episiotomy, first you have to infiltration should be done. Okay, that is by inserting 2 fingers with the help of lignocaine solution, you have to infiltrate the perineal region. Once it is infiltrated, then you can see the crowning of the head. Okay, this is what midline episiotomy, this is what mediolateral episiotomy. Okay, now this is the midline episiotomy or medial episiotomy. Next one is, this is the mediolateral episiotomy. Anyone you can choose, but mediolateral is safest one. Midline, there is a chance of extending of the incision up to the anus. Okay, that's why mediolateral is safer one. Okay, then once the baby is delivered, after the episiotomy, once the baby is delivered and the placenta is delivered, then the wound should be repaired at the, as I said, first vaginal mucosa, like that you have to suture the area, episiotomy wound. Okay, so this is after the procedure, that is, it will heals 3 weeks. Within 2 to 3 weeks it is started to heal. Okay, then apply ice packs during the first 24 hours. If there is a bleeding ittantandre, you can put ice packs. Okay, next is, this is regarding the episiotomy. I hope you understood.